This video will discuss about antifungal drugs. Fungal infection are mainly opportunistic in nature. That is, when the immune system goes down, the fungus take advantage and causes infection. The immune system can go down in AIDS, diabetes, cancer, pregnancy, etc. Now the drugs that we used to cope this infection have different site of action or target. Some of these drugs alter the cell membrane permeability. Some of the drugs alter the cell membrane permeability by making force in the cell membrane and thus leading to leakage of cellular content and thus leading to death of that fungus cell. These drugs include Azoles, Polyenes and Terbinafine. Terbinafine. So first drugs uh, altered the cell membrane permeability by making force in the cell membrane and leading to leakage of cellular content, leading to death of that fungus cell. These drugs include Azoles, Polyenes and Terbinafine. Other drugs will block the beta-glucan synthesis. Beta-glucan synthesis in the cell wall of that fungus, which is an essential component for cell wall synthesis, and these drugs include Echinocandins. 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 Still, other drugs can block nucleic acid synthesis by acting as antimetabolites, which are substances that inhibit cell growth by competing with the natural substrate. Competing with the natural substrate in an enzymatic process, these drugs can include flucytosine. Lastly, we have disturbed that microtubules function. These drugs will disturb microtubules function by Griseofulvin and thus inhibit fungal mitosis by acting as Griseofulvin inhibit fungus mitosis, acting as a fungal static drugs. Now we'll discuss each of them in detail. So azole, polyenes, Terbinafine, Echinocandins, Flucytosine and Griseofulvin. We will discuss one by one in detail. First drugs, polyenes. It include amphotericin B and nintedanib. First one is amphotericin B is actually an amphipathic molecule. That means it has both lipophilic and hydrophilic part. Now its mechanism of action is it interact with cell membrane of that fungus and thus reduce that spore. It has that wide spectrum of activity of all the antifungal drugs, and it's very good in systemic fungal infection, but its limiting side effect, nephrotoxicity, is a problem. The main side effect is nephrotoxicity. Coming at that mode of administration, it is not that water soluble, so it need to be administered in a lipid complex or a liposomal formulation or with detoxicolic acid. Detoxicolic acid is a bile acid. It is used to solubilize it in that IV form. it is not given orally because it does not have good cut absorptions and it cannot cross the blood-brain barrier. So if you need to use amphotericin B for meningitis cases, cryptococcal meningitis, then you need to give it intrathecally. And intrathecal injection is the dangerous process. It can lead to side effect such as convulsion, headache, and it is considered the drugs of choice of systemic infection. Systemic infection by Cryptococcus or mucor, etc. And it also effective against many other fungi such as Candida, Aspergillosis, Histoplasma, and mucor because it has wide spectrum of antifungal activity. Then the mode of resistance to amphotericin B can be by decreasing the quality of ergosterol of that cell membrane of that fungus, and it will not be affected by amphotericin B that much. The side effect can be dose dependent and non-dose dependent. It is actually the most toxic of all the antifungal agent. The dose dependent side effect include severe nephrotoxicity that can decreases the GFR glomerular filtration rate and causes renal tubular acidosis and also leads to magnesium and potassium wasting, and there is also a normocytic and normochromatic anemia due to decreased erythropoietin release. The non-dose dependent related side effects are fever, chills, muscle spasm, vomiting as a shock, like fall in blood pressure. It can be managed by antihistamine, antibiotic, mepredin and glucocorticoid, etc. Fever, chills, muscle spasm, vomiting, shock like fall in blood pressure can managed with antihistamine, antibiotic, mepredin and glucocorticoid, etc. Next, nystatin is too toxic for systemic use, so it is only used topically for localized infection. It has poor absorption through skin and mucous membrane, so that is good for us because we don't want nystatin in the systemic circulation. It is used oral and esophageal candidiasis by the Swiss and swallow method, by which the patient takes it and swish it hidden in his mouth and then swallow it. It can also be used for corneal, conjunctival, cutaneous candidiasis, as well as the side effect is nausea and bitter taste. Coming to azoles, it classified into imidazole and triazole. That imidazole comprises of ketoconazole as a prototype. So this imidazole, this miconazole and cotrimazole as well, while the triazoles comprises of fluconazole, traconazole and voriconazole. Finally, posaconazole. Now, azole inhibit fungal Phe 450 dependent enzymes such as 14 alpha beta demethylase. This enzyme is involved in conversion of lanosterol into ergosterol. Lanosterol into ergosterol. That is the final stuff. That is the final stuff of that ergosterol synthesis. By inhibiting ergosterol synthesis, it will damage the cell membrane of that fungus. Apart from inhibiting fungal 440 Phe 440 enzyme, and also inhibit human liver Phe 440 enzyme, and thus can be associated with drugs interaction. Now, ketoconazole is the prototype imidazole and it's most toxic among all the azoles. It can be used topically. That's why for the systemic use it has been mostly replaced by triazole. Increased acid, increased it absorption, that is after food when there is increased gastric acid secretion, and decreased acid, that is that can be due to proton pump inhibitor will decrease its absorption. It is high plasma protein binding, metabolized in the liver and excreted in the feces. Mostly important side effect you need to remember for ketoconazole: it inhibit of adrenal corticoid synthesis, just as it inhibit ergosterol synthesis in the fungus. Now, that is in male will causes gynecomastia, and in female will causes menstrual irregularity. In male it causes gynecomastia, in female it will causes menstrual irregularities. Ketoconazole is the drugs of choice in cutaneous fungal infection such as mucocutaneous candidiasis or dermatophytosis or dermal leishmaniasis. All of these are topical use, and ketoconazole is rarely used in systemic fungal infection because its inhibition of hepatic enzyme as well as adrenal enzyme. Meconazole and clotricamazole are also used topically, and among both of these, meconazole is safe in pregnancy, and these are considered the drugs of choice in the dermatophytic and candida infection. Also in otomycosis. There all are topical use. Remember remember to that triazole. First drugs, fluconazole is very important one, and you need to remember one of, because it has many advantages. This triazole, one of the main drugs is fluconazole, is very important. It has many advantages. So this firstly, this fluconazole, it has broad spectrum and antifungal agent. Secondly, it is oral and IV absorption is very good, and it can also given topically, and it is cross the blood brain barrier. in contrast to amphotericin B, because if we want to use amphotericin B for cryptococcal meningitis, then we have to give it intrathetically. So remember, in this case, even on oral or IV administration, it will across the blood-brain barrier and can be used in cryptococcal meningitis. It is excreted in that urine in unchanged form. Used in cryptococcus meningitis, candidiasis, coccidiotal fluconazole cannot be used in aspergillosis. For that, we need to use the next drugs is echinocandins. For that side effect, it is a enzyme inhibitor and thus will cause drugs interaction, and it also tetrogenic. So it is contraindicated in pregnancy, and it can cause hepatic necrosis and rashes. Next, itraconazole can be given IV or orally just as fluconazole, but it will not cross the blood-brain barrier in contrast to fluconazole, but it can be used in aspergillosis. It is a backup drugs for candidiasis. Oriconazole is the same itraconazole. Its enzyme inhibiting properties is a problem, and it can causes QT prolongation in pregnancy and also visual and auditory disturbance. Lastly, posaconazole. It also used in aspergillosis, mucormycosis, and food increase its absorption. The next drugs that we will see is terbinafine. Terbinafine will causes inhibition of ergosterol synthesis by inhibiting enzyme Q-lane 2,3 epoxidase. Enzyme name Q-lane 2,3 epoxidase. That is basically catalyzing the second last step in ergosterol synthesis. That is converting squalene into lanosterol. This step will inhibited by these drugs. Terbinafine drugs will inhibited. So the terbinafine is a suicidal drugs. It cannot cross the blood-brain barrier, so it is only used in dermatophytic infection. It can be used in topical as well as oral. And oral administration, it reaches high concentration in skin, nail, adipose tissue. The side effect include dyspepsia, hepatitis, and local irritation on topical use. Next drugs is Flucytosine, which is actually 5-flucytosine. It is a DNA based analog. Now this is a prodrug, and first it need to go inside the fungal cell, and for that it need enzyme permease enzyme for the fungus, and secondly it need to convert it active form, that is F-fluorouracil, and for that too it need for a fungal enzyme, that is cytosine deaminase. Enzyme name is called cytosine deaminase enzyme, which is actually the fungus to play a part in its own murder. The fungus knows better and it knows that you are there to kill it, so it will not give you those enzyme and will become resistant to this drugs 5 fluorouracil fungus to convert that prodrug into active form. Then this active form 5-fluorouracil is actually an anti-cancer medication which after forming a nucleotide, that is by triphosphorylation, will get incorporated into RNA and stop its synthesis. It also inhibit thymidylate synthetase enzyme and that's will inhibit the synthesis of thiamine. Next, flucytosine. Flucytosine has a narrow spectrum of antifungal activity and it is mainly used in combination with amphotericin B to avoid resistant and in severe cryptococcal and candida infection. It can cross the blood-brain barrier, so it can be used in cryptococcal meningitis, as well as the side effect include bone marrow suppression, leading to thrombocytopenia, leukopenia, etc. Thrombocytopenia, leukopenia, alopecia, liver dysfunction. The next drug is Griseofulvin, which acts by disturbing that microtubules of that fungus cell and thus will inhibit mitosis of that fungus cell. That's why it is static drugs. This is the drugs that used systematically for superficial infection. That means this is the infection in the skins or superficial area, but the drugs is given systematically orally now. Why is that? Because Griseofulvin has an ability to reach high concentration in keratin containing tissue such as nail, hair, skin, etc., where it is needed. It is generally used in skin infection by ringworm, that is tinea, and also onychomycosis. And important things to remember about Griseofulvin is that also has disulfiram like effect, that is it giving to make patient intolerant to ethanol, and it also an enzyme inducer, not enzyme inhibitor. By its enzyme inducing activity, it will decreases this effect of warfarin, and oral contraceptive. Lastly, we have Echinocandins, which are the drugs that end with fungin. These are gaspofungin and mycospongin. Their mechanism of action by inhibiting beta 1,2 glucan synthetase in the fungus cell wall and thus decreases the cell wall synthesis. It is not given orally, but it will give IV infusion form is given. Then it is expensive. This one is expensive and thus a reserve drugs in invasive aspergillosis and candidiasis. Side effect include fever, headache, gastrointestinal distress and rashes, and flushing is due to histamine released. So that's all about antifungal drugs.